everyone to our webinar today, 2021 E&M Coding Updates, Position Your Practice for the Changes. When you signed on this afternoon, you were muted. We ask that you remain muted during the course of the event. You may ask questions or provide comments in the chat box. We are also recording today's webinar and you will receive a link to the recording. Please use Zoom chat box to ask any questions during the course of the presentation, and questions will be answered by a presenter at the end. I'm going to go ahead. Where is Kelly? There we go. Okay. All right. Our speaker today is Denise Walsh. She is with Medical Business Advisors, division of KatzAbosch. Ms. Walsh is a certified professional coder with over 25 years of in-depth experience in medical practice management. In her capacity as a compliance officer, she is responsible. If you could please mute yourselves, we are getting started. In her capacity as a compliance officer, she is responsible for all aspects of regulatory compliance within each organization, including the implementation and training of medical practice on HIPAA privacy, security plans, and billing compliance. As a certified professional coder, Ms. Walsh performs third-party chart audits and trains providers in documentation and coding requirements. Please join me in welcoming Ms. Denise Walsh.
Thank you, Susan. I appreciate the introduction, and thank you everyone for attending today's webinar. We are going to discuss the 2021 E&M evaluation and management changes and how these changes will affect your practice. Next slide, please. So as most of you know, on January 1st, the AMA will put into effect its CPT code changes for 2021. There are 329 changes to the 2021 code set. Among these changes are the revised guidelines for office and outpatient E&M services. Next slide. So CMS announced in 2019's final rule that changes to E&M services would be initiated as an attempt to alleviate administrative burdens the current guidelines present to providers. Within 6 months of CMS's announcement, the AMA announced that it would have revised E&M code sets, that code set 9901 to 99215, effective January 1st, 2021. So here we are, less than 2 months before these changes go into effect. So what do we need to do to make sure that we are preparing ourselves for these new changes? Next slide, please. So before we go into the changes, let's step back and look at E&M codes and a little bit of E&M history. So evaluation and management, or E&M codes, are the most widely used CPT codes by providers because all specialties use these E&M office visits. The 1995 and 97 E&M guidelines have an emphasis on charting based on billing requirements and not necessarily on clinical need. And these CPT codes haven't been updated in almost 30 years. Providers have complained continuously to CMS that these guidelines are very ambiguous. They're too complex and they really do not help providers distinguish between levels. So CMS felt that this was a good time to update these guidelines and to make some changes. Next slide. Back a slide, please. So CMS has aligned themselves with the AMA to make the E&M changes. Now, the purpose of these changes is supposed to be to reduce provider burden. And you will hear, you know, the montage from now until the end of the year. It is patients over paperwork. So that is what they are hoping to do. You know, making sure that it alleviates a little bit of the documentation burden on the physician, on the provider. It also wants to recognize the amount of time a clinician spends, you know, taking care of the patient. The encounter is not only the time that the patient spends in the exam room, it is, you know, taking care of that patient from beginning to end, reviewing records, you know, coordinating care. So there is a lot more involved in the patient encounter. And, you know, the AMA and CMS are now really taking, you know, a look at that. The other purpose is to help clinicians focus on a path toward value-based care. Next slide. So what are the key revisions that we are looking at going forward for 2021? Well, first of all 5 of the established patient visits will remain the same. So that's the 99211 to the 99215. All levels will stay intact. But for new patient visits, they are reducing the number of levels to 4 levels. They are deleting the CPT level 1, CPT code 99201. And the reason for this is they are using medical decision-making to determine the overall level of the visit. And both level 1 and level 2 new patient visits had straightforward medical decision-making. So they've decided to eliminate 99201 to make this a lot more simpler. All of the code levels 99202 to 99215, these code definitions have been revised. The time and medical decision-making process for all levels have also been revised. And this is in hopes to give more clarity and give more definition and specificity on how to determine the appropriate level. The history and exam components have been eliminated as an element to determine the overall level, but they are still required as a documentation as appropriate for the patient's condition. And it will also allow, these new revisions will also allow a provider to determine whether they are going to use time or medical decision-making as the overall criteria for determining the level of the visit. Next slide, please. Next slide. Back one, please. Thank you. So what are the benefits of these revisions? Well, again, you know, they are hoping that it will decrease administrative burden of documentation and coding for the providers. Again, this is the patients over paperwork, to eliminate unnecessary you know, documentation in the patient's, or repetitive documentation in the patient's chart. Hopefully this will also decrease the need for audits. With the expansion of the definitions and guidelines, they're hoping that this, again, gives greater clarity and makes it fairly clear on the overall level of the visit. So hopefully it will decrease the need for audits in the future, or fewer audits in the future. It should also, again, decrease the unnecessary documentation in the patient's record that is not pertinent to the patient's care. So no longer will a provider have to worry whether they've met the criteria for HPI qualifiers, or have they documented enough systems that they've reviewed to meet the criteria for a level 3 or level 4 patient. You know, the history and exam are only pertinent to that patient's condition. And this will also ensure that payment for the E&M is resource-based, and that there is no direct goal for payment redistribution between specialties. Next slide. So as we discuss these changes, the bigger question is, are you prepared? What does your practice need to do moving forward to make sure that not only your providers, but your entire practice are ready for these changes? Next slide. We need to understand how these changes will impact your practice and who they will impact. So of course, they're going to impact your physicians and your mid-levels, your other qualified health professionals, nurse practitioners, physician assistants. They will need to have a good understanding of how to document these changes in the patient encounter. They will also need to determine which is best, utilizing time or medical decision-making as the criteria for their E&M level. If time is being used to determine the overall level, then the provider and the practice will need to have a clear method of tracking and documenting the total time of the encounter. So the new guidelines, it is not just the time that is spent in the patient's exam room. It is time that is used to review patient records, coordinate care. There's a list of criteria that that makes up the time element. So it's not just in and out of the patient room. So it'll be necessary for the practice to determine how this will work for them, and is it using time, is it a feasible option? And they will also need to have physicians and other providers will also need to have a clear understanding of the new medical decision-making chart. So in my experience as an auditor, I find that medical decision-making is the area in which most providers struggle a bit. Typically, if they give themselves a little bit too much credit for the medical decision-making for a new patient encounter, and maybe not enough credit for an established patient encounter. So with these new guidelines, this new medical decision-making table, it should really help clarify these guidelines and the overall level for medical decision-making. But it is pertinent for the physicians to have a good understanding of this, and maybe, even in the beginning, create themselves a possible cheat sheet to help them understand these revised guidelines. Next slide. So practice administrators will be crucially important to these changes. As a practice administrator, you're going to be responsible to designate a project lead to get this, get these changes rolling in your practice. You should really start beginning this transition period now. You want to make sure that you include all staff in this project. That would be everyone from your clinical staff to your admin, your clerical staff, billing, coding. They all should really be involved in these revisions and how this process will impact your practice. Coming in 2021 with these new E&M changes, there will also be changes to the E&M RVUs. So you should really review these RVU updates. This could make a financial impact on your practice. So the RVU values are changing, but in addition, the conversion factor is decreasing. So, it still looks as if the overall E&M fee will increase, the allowable will increase by CMS, but you really should take a look at this and review your CPT frequency reports. Make sure, see how this really will, impact your practice's bottom line. Also should look at your visit templates. Will they need to be adjusted? This is, whether it's for documentation or for your time-based coding. And you should also contact your E&M vendors. Will their systems be updated? You know, will they need to make changes? Does your current ENM, or excuse me, yeah, EMR use a encoder? And if so, if your physicians are using that encoder, will that encoder be updated to meet the new guidelines? And as always, as the practice administrator, it is your responsibility to make sure that you are getting your staff trained. And that is all staff, not just providers who are documenting. This is billers, coders. Everyone should be trained on these new guidelines. Next slide, please. So of course, your coders and your billers will be impacted by these changes. Again, they will need to know how to properly select an E&M level through the new guidelines. They will also need to have a clear understanding of the revised medical decision-making chart. If your billers and coders have not been trained on these new guidelines yet, we highly recommend that you do. This is very important. Training for, as I said previously, training for all staff is important, but it's very important that your billers and coders also go through some type of training. They need to make sure that they are understanding from a billing perspective, you know, what are the commercial payer requirements? Now, the commercial payers have, for the most part, all go with AMA guidelines, and you will see in their provider manuals, typically they say for billing and coding, they follow AMA guidelines. So there really isn't an issue with most commercial payers on what they're going to do with, you know, come January 1st. But there are some outliers. If you are a practice that has a lot of workers' comp or self-funded plans or RISA plans, you know, they're an entity all of their own, so they don't necessarily follow AMA guidelines. So I would reach out to them, you know, kind of figure out what they are doing moving forward. Will they be following old guidelines? Will they be following new guidelines? You know, and plan accordingly. You know, make those make adjustments throughout your practice. I suggest for coders, billers, but especially coders, be proactive. Do a comparison of your current documentation. Does it need to be revised? You know, does your current documentation, does your provider's current documentation, will it hold up to the new coding? You know, where are there gaps in the documentation? You know, so, you know, take a look at it now and you know, working together, coders with your physicians, you know, it will help for a smooth transition with these revisions. Again, for the coders and the billers, you know, greater clarity in the definitions of these new codes or these revised codes should help you code more accurately. And again, the hope is that with greater clarity in these definitions, it should lower your risk of audit. Next slide, please. So although these changes are for professional services only, this is for office patient and outpatient E&M, it will still have some impact on the health systems and hospitals, okay? Again, they will need to determine changes that will directly affect their coding and billing business model. This should improve patient care again and again, as we say, reduce administrative burden and reduce physicians' documentation time. And again, with the greater clarity in definitions, it should reduce their risk in audit. Next slide, please. So also involved in this impact and these changes are your tech vendors. And I would say at this point, we are already in November. I would reach out to your vendors right now, your EMR vendors, and ask them what types of revisions are they working on for their software? What you know, will they make changes, you know, according to these new documentation guidelines? Are they updating their encoders? You know, when will these revisions take place? What are the timelines? You know, what do you need to do to templates to, accommodate these changes. So it's really important that you get your vendors involved, and then make sure that you're communicating this with your providers, because if you're changing templates, you know how providers, physicians can be, with changes like that. So we need to make sure that, again, here's another opportunity for training and making sure that your physicians are aware and trained on any template updates. Next slide, please. So as we get closer to the January 1st guideline, we really need to look at this as it is a team approach. A team approach to make sure that you are ensuring practice compliance. Everyone has a role. Your clinician is responsible to make sure that they are documenting accurately. Your coding professionals to make sure that the coding is consistent with the new guidelines. And then your administrators to ensure billing compliance and to make sure that they are managing the impact on the revenue cycle. Next slide. So this is really important. We should, as we look at this, we are in the first week of November. We really need to start this now to prepare for these changes. So what do? Honestly, you need to start getting a committee together, create a to-do list, designate a project lead to make sure that this transition goes smoothly. And as I mentioned before, make sure that each area is involved, because this will affect, clinical, coding, your administrative. Everyone should take part in this transition. Again, as I just mentioned, contact your EMR vendors regarding the updates to their system. Review templates and determine whether changes need to be made for these new guidelines. You should begin educating all staff. Provide them access to resources such as the AMA, CMS, and the AAPC. All three of those sources have tons and tons of information on their website regarding these revisions and the upcoming changes for 2021. So, if you are currently not getting updates, not getting newsletters from these sites or from your payers, I would strongly recommend that you sign up now and start getting these updates so that you can see, things on a regular basis. You can get these newsletters and you can disseminate that information accordingly to your staff. Next slide. So here in November, we recommend that you start taking a closer look, as I said, at the new requirements and determine where there may be gaps in your provider's documentation. The old adage is if it wasn't documented, it wasn't done. So you need to make sure that the provider documentation falls in line with the specified criteria in the new medical decision-making table. So look at your current documentation. What E&M level does it support? Will that transfer over to the new guidelines? Again, look where you're seeing the gaps, where you can, educate staff, educate providers. What are you missing, and what do you need to do to meet the current or the new criteria? Recommend that you start looking at testing the time element now to determine feasibility. As I said, when you look at the time criteria, it is not just the time that the provider spends in the patient's, with the patient in the exam room. It is the total amount of time on the date of service. And I stress that, on the date of service. It is not after the fact, the next day, next week. It is everything that you do on that date of service that is relevant to the patient's care. This isn't ancillary staff time. So this is not time that medical assistants or techs will spend with staff, or the staff, or that the patient is having testing done. But this is time that the provider is spending with the staff, with the patient, reviewing documentation, coordinating care, reviewing test results, whatever it might be. that is the total time on that date of service. So again, how are you going to determine if this time is broken up into segments during that date of service? How will you track and maintain that time? Update your protocols, your workflow documents, as well as policies and procedures if necessary to meet the new guidelines. And of course, continue educating your staff on coding and documentation changes. Next slide. As we get into December, we recommend that you review the CMS final rule. Start looking at the financial impact this will have on your practice. Again, this would be running the necessary revenue cycle reports to determine if the changes will affect your practice's bottom line. Again, review your commercial payer guidelines, make sure that there are no changes. Look at your contracts to make sure that there are no carve-outs that are relevant to these E&M codes. You want to make sure that you organize a collaborative session with everyone in your office, coders, auditors, clinical staff, to ensure that everyone understands these new E&M changes. And then again, take a look at your EMR templates, and if you need to make any finalized changes to the possible new templates. Next slide, please. And so ongoing, as we not only now, but as you go forward into 2021, you want to make sure that you are always staying compliant with state and federal regulations. And as I said before, it's really important to sign up and get the newsletters, whether it's from your Medicare, local Medicare administrative consultant, or whether it's the AMA, or whether it's the AAPC or your commercial payers. You always want to make sure that you are up to date on all of that information, making sure that you know what's going on, and that information continues to be distributed to your staff. Next slide. So again, don't panic. There is still time. We want to make sure that you start today. Start preparing your practice, your staff, for these new changes. Next slide. So KatzAbosch, we are available. We can offer your practice individualized group training on these upcoming changes. We have sessions that are available for not only providers, but for clinical and billing staff as well. So if you have any questions, or if you would like to schedule a training session, our information is on this slide, and it's also, I think everyone will get a slide deck with our information on it as well. Want to make everyone aware that we have an upcoming webinar that we'd like to invite everyone to. On November 11th, we have a webinar, Selling a Medical Practice, Strategies for Success. Again, that's November 11th. So at this point, next slide, like to go into ask anyone if they have any questions. If you haven't, as of yet, put your questions in the chat box, please do so now. We would like to, we'll be available to answer those at any time.
Thank you so much, Ms. Walsh. I'll go through the chat box. Please put your questions in there. Our first question is, are outpatient consultation codes being eliminated for commercial insurance?
Well, that really doesn't have, the consultation codes are not changing. But to answer your question, that is a payer-specific issue. And I do know that some payers are eliminating the consultation codes. I would say contact them individually, see what their guidelines are going forward for 2021. do not know the specifics of the commercial payers on who has decided to eliminate those codes, but I know that some are.
Great, thank you. The next question we have is, can the time a physician spends writing or dictating the progress note be used to justify the code when using the time element as a criteria for coding the E&M?
So that's sort of a yes and no answer. So yes, it is considered the documenting the record is part of that as well. But if you have a physician who is a notoriously slow documenter, or is somebody who, let's say you just switched to an EMR and you are going through that learning curve of how to use an EMR and document in the EMR, and because that is a slow process, you cannot use that extended time as a, as a way to determine the level of the visit. You cannot use time that way. So, but documenting in the patient's chart, dictating in the patient's chart is considered part of one of the criteria to use for time.
Great, thank you. Next question is, where can we find the specifics on these new time and MDM guidelines?
So that's a great question. First thing that I will recommend is that you go to the AMA website. The AMA has a specifically lays out the changes for 2021. They will give you the new definitions for the E&M codes. They will, and then it gives you the criteria for time. Novitas Solutions also has a link, and if anyone is a member of the American Academy of Professional Coders, AAPC, they have a lot of information as well. I always recommend that practices get CPT manuals. And I know a lot of, no one likes to do this yearly because they can be expensive, but especially in a year like this where changes are occurring and these are major revisions to E&M codes, I would highly recommend that everyone get the CPT manual so that you have that on hand and as a reference tool to use to verify any information that you're looking for.
Great, thank you. Next question, how will this impact the current pandemic telemedicine codes in use until after the pandemic?
So it really doesn't. So there is a list of telehealth approved codes. None of those codes are being affected by this except for the E&M visits. And the way that it currently reads right now, at least Medicare guidelines, Medicare is already using the 2021 sort of methodology to code the E&M visits. So they are all right now, they are saying, you can use medical decision making as the determinant for the level for your telehealth visits, or you can use time as well. But again, the time criteria, the criteria changes a little bit going forward. So it's still the current time criteria for telehealth. So it will affect, it really does make it, the new criteria using medical decision making will make it easier for telehealth visits because of course, when you're eliminating history and exam as a criteria to determine the level, then it makes it easier because telehealth, of course, you're not going to be doing a hands-on exam. You could be doing constitutional, documenting constitutional elements. But so, those things no longer come into play for the level. So it will make, it easier to meet the criteria for a telehealth visit.
Thank you. Next question. Are our telephone psychiatric sessions with specific prescribed codes defined by time spent no longer be relevant?
So, so those are the psych codes that go with the E&M. So the only, you cannot bill, so if you are billing your the site codes based on time. You cannot use an E&M with it based on time. So the E&M, the site codes themselves are not changing, only the E&Ms. So the E&M that you will bill with that site code, and it's usually for the medication management, you'll have to determine that level based on medical decision making only. I hope I answered that appropriately for you. If not, you may want to email me offline and we can discuss it further.
Great, thank you. It looks like that person will in fact email you. It looks like we have no further questions at this time. I want to thank everybody for joining us this evening. This afternoon. It feels like evening, doesn't it?
Yeah, it's confusing us all.
Exactly. Thank you so much, everyone, for joining us. We have recorded today's webinar, and we will be sharing the recording with everyone via email. I hope we have a bunch of COVID-19 resources on our website, montgomerymedicine.org, where you can also get more information about renewing your membership. We're heading into the new dues year. We have some new, we have events coming up, and of course, our ever revolving resources. Thank you so much to Denise and to everybody for joining us this evening.
Thank you for
Afternoon,
attending
thank you.
Thank you, everyone.